Meeting is now called to order. 9 o'clock. We'll begin with a moment of silence, silent reflection, or silent prayer. So before we get going, we've got a few extra announcements for this morning. So first I'm going to talk about some of the actions that have been taken at this board meeting in response to the coronavirus. Members of the public in attendance should maintain a distance of 6 feet from individuals in the board chambers by sitting 2 to 3 seats apart and 1 to 2 rows apart. No more than 2 staff members should be seated at the staff table at any one time. Additional speakers may use the podium as needed. Board members and staff on the dais have been modified to maintain the distance of 6 feet. Public comment forms will not be required to address the board. Members of the public wishing to speak may approach the podium one person at a time. We would appreciate you giving your name before you begin your comments. Microphones will be remotely operated by the clerk of the board. Please do not touch them. If you need the podium adjusted, a member of our staff will assist you. A standing hand sanitizer dispenser is available outside the board chambers for anyone entering or leaving the chambers. So we'll go ahead and begin. Supervisor Wynn, will you lead us in the Pledge of Allegiance?
Sure. I pledge allegiance to the flag of the United States of America, the republic for which it stands, one nation, under God, indivisible, with justice for all.
Thank you. For the record, this is the March 17th, 2020 meeting of the Board of Supervisors. Will the clerk please take the roll?
Supervisor Villapouva.
Present.
Supervisor Patty.
Yes.
Supervisor Wynn.
Here.
Supervisor Elliott.
Here.
Madam Chair Miller.
Here. Thank you. Now is the time for public comment on matters within the jurisdiction of the Board of Supervisors that are not listed on the agenda and any matters listed on the consent agenda. We request that you approach the podium one person at a time and wait to approach until the previous speaker has returned to their seat. There's a time limit of 3 minutes for these comments. There's a device on the podium with a green, yellow, and red light. The yellow light will come on 30 seconds before the end of your 3 minutes. Members of the public who are watching this board meeting online, you may submit your public COB records at sjgov.org. Public comments received via email will be shared with members of the board and made part of the official record. With regard to public comment, the law strictly limits the ability of board members to discuss matters not on the agenda, so this is not an appropriate time to have a discussion with the board regarding your comments. We ask that you refrain from personal attacks during your comments and that you address all comments to the Board of Supervisors, not to the audience. Comments from the public may not reflect the viewpoint of the Board of Supervisors. Clerk of the Board, have we received any public comments?
Not at this time, no.
Okay, thank you. I'm going to just ask you, I will ask periodically, and before we adjourn, but I'm going to ask if any come in, just go ahead and flag us, and we'll go ahead and take them as they come. Thank you. Okay, our first item for discussion is a proclamation of a local health emergency in San Joaquin County. So I'm going to ask for department staff to come on up and present this.
Thank you, Chair Miller. I was asked to start by giving a short presentation on COVID-19, so if we have that, if I could have that up, please.
Dr. Park, for the folks watching online, would you identify yourself?
Yes, I'm Dr. Maggie Park. I'm the Interim Health Officer for San Joaquin County Public Health Services.
Thank you.
Thank you. So COVID-19. The source of this novel coronavirus is still not specifically known. The initial outbreak was associated with a large animal and seafood market in Wuhan, China, and that was suggestive right off the bat that there was a zoonotic origin. The virus has now been named officially by the WHO as the SARS-CoV-2 virus. It has been fully cultured and sequenced, and we know through genome analysis that it is related to SARS and MERS. It is a beta coronavirus. There are alpha, beta, delta, gamma viruses. This one is a beta virus, just as the SARS and MERS viruses were also beta coronaviruses. Nearly all coronaviruses are thought to have originated in bats. SARS and MERS originated in bats. And then there's an intermediate animal reservoir that will cause the jump from animals to humans. With SARS, it was a civet cat. With MERS, it was found to be the camel. And with COVID-19, it is yet unknown, but our prime suspect is an animal called the pangolin. The earliest hospitalized case had onset December 1, 2019 in China. Globally, we found out that this was a novel coronavirus sometime in early January. But this picture depicts the amount of traveling that was done in October and November 2019 from Wuhan to other parts of the world and within China itself out of Wuhan. And as we know, the government of China restricted travel outside of Wuhan and Hubei province starting January 23rd. And there was a Lunar New Year celebration January 25, and we believe that many people had already exited the area before January 25 to start their celebrations and to make it to family members in other parts of the world. In the United States, as of March 16th, according to the CDC, there are a total of 3,487 confirmed cases of COVID-19 with 68 deaths. And as you can see on this map, which is ever-changing, it is basically in all states except for West Virginia and our U.S. territories. In California, the latest numbers we have are from March 15th, and these numbers are ever increasing as well. We're at 335 confirmed COVID cases with 6 deaths, and now I believe the news is reporting a 7th. I'm not sure if that has been confirmed yet. As you can see, a majority of these deaths occur in adults, with only 6 cases in California being in the age group 0 to 17. Here in San Joaquin County, as of March 15th, we had 9 positive cases. I will tell you that as of this morning, we will be reporting that we are at 13. And I do have some numbers here as far as the way that the people who we know are positive had transmission. 3 were travel related, basically from cruise lines. 2 household contacts, so person to person. 2 are presumed to be community spreads, so examples of people who have had no history of travel to an affected geographic region and who have had no contact with a confirmed COVID case. That is the definition of community spread. And the map that I'm showing you here is a map put out by the California Department of Public Health, which shows that as of yesterday, we are a county that is recognized for having cases of community spread. None of our cases are those in children. I will let you know that. So how does this virus spread? The research is going on about transmissibility. Initially, it was felt to be only animal to human, but that was quickly reversed, and we knew from very early on that there was person-to-person spread of this disease. And now we do know that there is community spread. Person-to-person spread occurs largely via respiratory droplets, so this is considered a respiratory disease, coughing and sneezing with close contact. So when I say respiratory droplet, I mean somebody coughs and sneezes, their sputum will travel about 3 feet and by gravity drop to the ground. And if you are within that perimeter and it enters your nose, mouth, or eyes, you could get the disease from somebody else close to you. The CDC uses a distance of 6 feet to give us a cushion around that. This is not airborne, as some people might think. This virus is not suspended in the air. It's likely to be most contagious when a person is most symptomatic. There have been some reports of asymptomatic people being able to spread the disease, but we do not feel that this is the main way this disease is transmitted. And it may be possible that there is contact spread by touching a surface or object where the virus has fallen through that respiratory droplet and landed on a surface, and then touching that surface and then touching your mouth, nose, or eyes.
Excuse me, Dr. Park, do we know how long surfaces would remain contaminated?
That research is ongoing as well, and there were some preliminary reports, and of course people are reading the news and receiving a lot of misinformation that it can last for a month. What we feel now, and information coming from the California Department of Public Health, is that it's likely to be about a couple of days that a virus can last on a surface. However, it's very easily killed with standard disinfectants. For some reason, this virus is very killable, and this is why we have been advising the public to constantly wipe as frequently as they can their tables, countertops, doorknobs, handles, frequently touched surfaces with regular disinfectant. The CDC, right from the get-go, used an incubation period of 2 to 14 days, and this is because we knew it was related so closely to the original SARS, and that was the total incubation period for SARS. But similar to SARS, the regular incubation period is really probably around 6 days, and studies initially coming out of China show that for SARS-CoV-2, the incubation period is right around 5 days. The serial interval onset from one clustered family giving it to the next is about an interval period of 7.5 days. This is all preliminary research coming out of China, which of course has had the most cases, and research is still ongoing about this. But by saying that an incubation period is 14 days, we believe again that there's been a cushion built around the actual incubation period. Now, there are many questions about the infectiousness of SARS-CoV-2, and there is a number called the R0, which is the number of people that one sick person will infect. And the R0 for Ebola was 2, for mumps is 10, for example, and for measles, which is an airborne disease, the R0 is 18. So what is the R0 for COVID-19 virus? And again, these are all initial studies, but they all seem to hover around an R0 of 2 to 4, and some people are calling it a 1.5 to 3.5 R0. And so in comparison to SARS, it's about the same. In comparison to seasonal flu, it is a bit higher, and even to the swine flu pandemic of 2009. So there is some validity when you hear that COVID-19 spreads a bit faster than the flu and is a bit more infectious. However, I try not to put a lot of emphasis on these numbers because they're still preliminary, and as we know, we have much more flu going around in this country yearly, and at this point, although we've had no deaths from COVID-19 in our county, we're up to 12 in San Joaquin from the flu. Mortality rates are still being studied, and at this point is widely unknown. As people are more widely tested and mildly ill people become tested and are not dying, the mortality rate will probably fall and might fall to about the same as our pandemic flu numbers, about a 0.4, 0.7, some say as high as 2, and so it's just not known, but it probably will be a little bit higher than seasonal flu numbers. So prevention, and the NIH is working with several different companies trying to fast track the development of a vaccine, and the vaccine will hope to modulate a spike protein on this virus. If you notice in pictures, the virus is shown as a ball with many spikes on it. Those proteins help the virus to attach to the linings in our lungs, and that's the part of this virus we're trying to modulate and trying to stop that from meeting its receptors. So animal studies are ongoing, and phase 1 trials have started in some companies, but it will be, according to the CDC, 12 to 18 months before we may have our actual first vaccine. Because as you know, we have to have studies in animals, and then we have to make sure that there are some preliminary studies in humans, and that the benefits of a vaccine far outweigh the risks. So at this point, with no cure to this particular disease, our focus is still on prevention, and prevention goes a long way, and we are always preaching the hand washing and the don't cover your eyes, nose, and mouth, and these seem to be very simple messages to the public, but the messages that we still want to get out there because these prevention methods should go a long way, and so we stress that this education is ongoing as we try to mitigate the disease in our area. Thank you. And I believe that questions, I could try to address them now.
Do any members of the board have any questions? Supervisor Patty?
Thank you, Madam Chair. So the flu season is a season, and we feel that, believe that as the weather gets better, we're transitioning out of the flu season, that the risks and probability of contracting this would be declining rapidly?
We certainly hope that in public health, that there's going to be some truth to that, and there is some science behind that, but it is a new virus. What we know from the original SARS virus, not SARS-CoV-2, but SARS virus, there was some truth to seasonality, but I can't guarantee or make a statement for certain that there will be a peak and then a fall.
Thank you.
Supervisor Wynn?
Thank you, Madam Chair. If I understood you correctly, we've had 12 deaths.
No, we have 12 confirmed. We're actually.
I'm talking about flu.
Oh, flu, yes, sir.
Okay. And how does that compare with, normal years or average? I mean, are our flu deaths higher than normal or lower than normal?
Very similar to past years, just a tiny bit higher than at this point last year into the flu season.
And based upon, all the information that's out there, and certainly information provided by the county, it would seem probably the best or most optimistic outlook is for individuals to take care of themselves and protecting in regards to not being exposed to the virus, as opposed to oftentimes people expect the government to solve problems. And in this particular case, it seems like individuals are in control more than the government is.
I would say that on an individual level, if I were to advise someone who did not want to contract this virus, that would be true. The best advice is to stay away from sick people because as I explained, you get it through respiratory droplet. So the best thing that you can do is to stay away from sick people, cover your own cough, wash your hands, clean the surfaces that you touch, and do your best to stay well and to keep those around you well. So yes, and all these social distancing measures that we're taking hopefully will go a very long way when it comes to our communities. We'll heed the advice.
Thank you.
Thank you. Any other questions?
Supervisor
Elliott.
Yes, thank you. So we discussed now that there have been 12 deaths related to flu, and how many now related to, we haven't had any in San Joaquin County yet, have we?
No deaths in San Joaquin County, and I believe the number for California is at 7.
7, right. All right, and then you made mention of mortality rates, and can you go over that again?
Sure.
It sounded as though the mortality rates would probably, as more and more cases are identified of people who have it and don't get seriously ill or die, the mortality rates may go down.
Exactly.
Can you give us those numbers again?
So in the beginning, there were maybe 20,000 cases, then it went up to 60,000, then 80,000 globally, and I was watching this on the Johns Hopkins dashboard, always looking at the numbers and calculating how many had died divided by how many cases there were. And it really did hover right around 2.1, some days 2.2, 2.4. And so a lot of the press and the news coverage and the science really is that the number is at around 2, because that is the reality when you look at the numbers now. Are the numbers skewed because most of these numbers were coming out of Hubei province, an area that had been isolated where people were not allowed to leave, and it kind of acted as an incubator almost? Maybe it's skewed because of that. Are the numbers skewed because we are not testing as many people as we could be testing? That is what the WHO believes, that people can be asymptomatic or mildly ill, not know that they're carrying the disease, and not be tested. That's not to say that we should be testing all of those folks. But if we were to have countless amounts of tests, which is not the reality, but if we were to have countless amounts of tests, test everybody who's asymptomatic or mildly symptomatic, those people are not dying, and that would drive the fatality rate down, and it's felt to maybe going to rest at a fatality rate of 0.7. Seasonal flu's fatality rate is 0.1 to 0.2, so as I said, it still might fall at a fatality rate that will be higher than seasonal flu, but the overall numbers of flu are just much greater, and as you know, in the United States, there's 20,000 deaths from this year alone, as I said, 12 in our county. But the numbers in our country for flu are just so much greater, so that even though the fatality rate is lower, you're going to hear about more case numbers of deaths. I hope that makes sense.
Yes, it does. Now, do we have sufficient numbers of test kits or test capabilities here in San Joaquin County to handle the reasonable needs for it?
At this point in time, we have not had to turn down any doctor who has wanted to test a patient. We do use specific criteria from the CDC that guides us as far as knowing when we should test and when we should not, because we know that there is not an infinite number of test kits out there. And although people may hear on the news that anyone can be tested as long as they want to, that's really not the reality. There is a finite number of tests. But those who are very sick, hospitalized, intubated on ventilators, we are prioritizing them for sure, and we are definitely able to reach sick people and get testing done for doctors who want sick patients, yes.
Okay, is there anything we should tell the public about this testing, or just tell them, see your doctor if you're sick, and he'll determine whether you need a test or not?
That is the route we would like people to take. The message is, if you have symptoms at all that are concerning and you think you might have COVID-19, start by contacting your healthcare provider. And depending on who that is and what insurance you have, you may be directed one way or another. We are testing for this virus now locally at our own San Joaquin County Public Health Lab.
But I want to make sure that it's primarily via doctor referrals.
Yes. Now, by referring to public health, I don't know if you mean that we are conducting the test. The test involves putting a swab up somebody's nose and getting a nasal sample and sometimes an oral pharyngeal sample. That test is not being conducted at San Joaquin County Public Health on Hazelton Avenue. We are receiving the specimens in our lab, and our lab is running the specimens and resulting them, but we are not conducting the test at our facilities.
So basically, it would be your healthcare provider who would be actually conducting the test. Okay. Supervisor Villapudua?
You know what, Supervisor Elliott asked my question. Thank you.
Supervisor Patty?
Thank you again, Madam Chair. I had a couple of follow-up questions for you. It's been expressed that some of the healthcare providers that might be doing the testing would also be subject to quarantine because they've been around somebody that's testing positive. So there's a concern. Are we at the county, are we offering, or what can we do to allow maybe perhaps drive-up testing instead of in-office testing?
And there are 7 area hospitals in our county, and when we did have passengers off the Grand Princess cruise line who needed to be tested, many of them thankfully stepped up and did do some testing outside of their EDs in tense situations. They did get special permission from the state to do this, and some of those facilities are still conducting tests in that way. Not actually drive-through, but drive-up. That's still available. As far as your question on healthcare workers with exposure, anybody who thinks that they might be who is a healthcare worker and thinks that they might have somebody who needs to be investigated, obviously has a patient who is sick, and if they're sick enough that the doctor is thinking that they might have COVID-19, really before they do anything, they need to be putting on their personal protective equipment. So if they follow the guidance from the CDC, they would be wearing personal protective equipment and should not be putting themselves in harm's way if they do so.
Okay, it is a concern though. So if they're protecting themselves, then that would alleviate that concern. You mentioned the 7 area hospitals, and you talked as you followed up that there was offered locations for exterior testing. where are those locations currently in San Joaquin County?
I'm not honestly aware of exactly who's still doing that. That effort was really ramped up when we had the cruise line, and I'm not sure that they're actually, that I can guarantee what those locations are. And in fact, I don't think that those emergency departments could handle a large announcement that they're open for business and handle the traffic that would come through. The messaging that we'd really like to get out to the public is don't go to the emergency department if you are only mildly ill. Please stay home, stay out of the emergency departments if you can, because we would rather not have you either one, infecting the entire ED, or two, getting sick yourself from picking up something new in our EDs. Our hospitals are congested as it is, and the advice really is to seek health care through your health care provider, who can then evaluate your symptoms, go over your clinical history, and then go from there.
Okay, and as you mentioned, the hospital is already perhaps stressed and the possible need for increased capacities. Is there anything, as we talk about the testings, is there anything we can do at the county level to reduce some of the restrictions, open up and increase some capacities that allow the services that might be able to be provided for testing and care? And then looping in to the same question is, what are we doing to increase staff? Is there also something, I know that at the different states, in New York they were relaxing regulations and standards and recruiting a lot more volunteers for staff to address this swelling concern and
Right.
possible need for
Yes,
care.
thank you. So at this point, I think what I would like for people in government to assist me with would be to get more test kits, because I can't ask you to help me get more testing facilities up, more drive-through facilities up, more hospitals doing the testing until I know that I have the test kits to run the tests. So, I mean, that would be the priority. We did receive a finite number of test kits at the San Joaquin County Public Health Lab, and we're hoping to get more, but at this point, you know, we're bound to run out, as we are running 60 tests a day. There are commercial labs up, so I would also ask that you get that messaging out that we are not the only lab in town now. As of last Monday, Quest and LabCorp now have this testing done so that your primary care provider can utilize those services as well and decrease some of the congestion in our own facilities. So that's another option. And as you might have heard Governor Newsom say on Sunday, Quest is really going to be vamping up their services. And a majority of testing can be done through that commercial lab as well.
Okay. And what about the question of increasing staff and volunteers, medical students? There could be a greater need and a way to facilitate getting some people qualified to be a healthcare taker, healthcare assistant.
And there may be a need for that, and you could perhaps address that with our actual healthcare facilities to see if there's a need. Just yesterday, I did issue an order to restrict visitors to the hospital. We're really trying to keep this at bay, so only in cases of extreme situations do we even want visitors to be in the hospitals. So I would be cautious to invite people who still require training, who still require the usage of personal protective equipment, which some of our facilities are running low on. And so if you have medical students and other people coming in and using up supplies and being extra bodies in an area where we're really trying to decrease the number of bodies, I would be cautious as to how many the healthcare facilities would take on. There may be some other situations in which volunteers could be utilized outside of the healthcare.
Do we have, I'm just thinking ahead and on that vein of thought, do we have any plans to recruit? I mean, we have students that attend the University of Pacific that might be pre-med. We have a plethora of people that are in the process of medical training and close to, but maybe not fully licensed. Is there anything we could do to expedite that process so we have staff available for medical assistance? They may not be doctors. They may not be able to do full treatment, but we've trained, we've got adequate numbers of masks, protective gear, whatever might be needed, so that we're one step ahead of that necessity when it arises, and if it arises.
Good morning. This is Deanna Blackwell Rodriguez, Public Health Director. The reason that we're here today is asking that you ratify the declaration so that we can leverage those resources. To expedite the request for any additional support services, we need the declaration. Otherwise, the process is tedious.
Excellent. Appreciate that. And that's obviously we will do that. Just there's a lot of questions for a lot of people. A lot of constituents have reached out to me. I think I have one more. You mentioned the number of people, the cases that we have testing positive here in San Joaquin County. Do we have the proximities and locations of where those that are testing positive? Is it isolated to a section of San Joaquin County, or is it throughout?
I can only tell you that it's countywide.
Well, you've got cities and you've got a vast county, so you've got north, south, east, and west. Is it?
Right. This is it's a matter of privacy, and we're not able to release specific city information.
Okay. Thank you.
So again, as Deanna Blackwell Rodriguez, Public Health Director, I would just like to give you an update on the operational status at Public Health. So we have expanded our operational hours to 7 days a week. We have implemented a phone bank that has been up and running for over a week. We have actually had to expand that due to the high call volume that we're receiving. We have pulled all of our health educators to provide education to entities and organizations that work with vulnerable populations. We have reached out to elected officials, any key stakeholders in our county to provide guidance. We are releasing guidance and daily press releases that are found on our website. So again, I can't ask you enough to move forward with the declaration to support the work that is happening at Public Health. And did you have any questions about where you can get further information? The phone bank 468-3411 is going to take you into our phone bank, and we encourage people to call that number. It will give you a number of options to get you to the right place within the department. And I cannot reiterate enough that while this is considered a public health emergency, this is not a public health only issue. We need all hands on deck in our communities and our counties to help us do the work that we're doing. So again, if people will start call to their providers if they think that they have symptoms that warrant treating. Otherwise, follow the directives by the health officer and stay home if you're ill and wash your hands.
That number again, please.
468-3411. And also our website is updated with all of the guidance that has been released. We are constantly monitoring the CDC and the CDPH website, as well as participating in daily teleconferences to assure that we are providing the most current information. And we're also working to assure that the link on the county website is updated as well.
Is there a website address or just the San Joaquin County General?
Both the sj.gov and sjcphs.org.
SJC.
sjcphs.org.
Thank you.
And the other one is sjgov.org. Okay, we have a few questions. Supervisor Elliott?
Thank you. Yes, a few more questions here. So now, does this emergency declaration that we're approving today, does it include all of the authorities that we need in order to make sure that we can access assistance from both state and federal levels?
So the health emergency declaration would free up resources and funding for public health. A county-wide declaration of emergency allows the county to pull down from different funding. So there are two different buckets of money that are available in the event of an emergency. So the public health is responsible for the health emergency piece. And so that's what we're asking, is for the additional resources and availability of funding to support the work that public health is doing.
So, directed to county administrator, are the authorities here in this public health declaration sufficient to ensure that we can get access to all of the assistance that's available out there?
Supervisor Elliott, Chair, and board members, what our Director of Public Health did address is very health related. You will hear today from our Director of our Office of Emergency Services, Ms. Cunningham. We're going to declare a local emergency today, and we will bring it back for board's consideration next Tuesday. What the local emergency, and as she's walking up here, she could speak from the podium. That'll give us greater flexibility from a purchasing power perspective. We have not needed that so far, and so, but in the event we do, when this was declared by our public health officer, our health emergency, some counties were primarily just focused on the health piece, which I felt the decision was very appropriate, that we immediately declared the health emergency, and that's why it's here today. But now we're at the point, and Ms. Cunningham will address why a local would bring some additional necessity, and exactly as you heard from public health, they could use some additional support from our incorporated areas along with our call volume. So that'll expand some additional resources and also provide some opportunity for our incorporated cities to assist and hopefully be able to get them reimbursement if it becomes available. Ms. Cunningham.
Good morning, Chair, Board of Supervisors, Monica Nino, Council, Marcia Cunningham, Director of General Services and the Director of Emergency Services. We are here today and we would like to declare a local emergency related to the novel coronavirus, COVID-19 is how it's known to most. The initial request came in yesterday in discussion with the Healthcare Services Director, Greg Dietrich. This is going to allow us to provide additional support for public health and our local agencies who have also been reaching out to us. It does potentially provide additional sources of funding for responses for expenses that have been incurred. We have sent out an email both to our department and outside agencies, getting them going on the appropriate paperwork to start to collect the expense information that's very critical for us, applying for funds, applying for reimbursement as we move forward through this event. Not knowing how long it could go on, we have a $2.9 million threshold that could very easily be met in regards to a reimbursement from where we're spending our time as it relates to this virus. The governor, as we all know, already declared a state of emergency. So as a county, we are covered as of March 4th. I can share with you there's 5 cities within our county that are proclaimed a local emergency as of yesterday: Manteca, Lathrop, Stockton, Lodi, and Tracy. We have coordinated what's important here for all the agencies to come together is the Multi-Agency Coordination Group, also known as MAC. That meeting will happen tomorrow and will bring together all the executive members within San Joaquin County and mutual aid providers so that we can discuss a common approach that we should be taking within San Joaquin County, and that allows us to protect and serve our citizens all in a equal manner. So there's a level of just calmness and, it is an event, but we all need to remain calm. And I want to reiterate what public health has reiterated. It's about taking care of ourselves somewhat, washing our hands, keeping areas clean, and doing those things. So with that, council, is it appropriate then for me right now just to declare, and we would bring back the ratification to the proclamation at the March 24th meeting, which would be next Tuesday, for it to be ratified? We have 7 days from this declaration today to do that.
The board is limited on the actions that it can take today to those items that are listed on the agenda. Your action of declaring the local emergency is independent of the board's action.
Okay. So I am declaring it in support of the public health local emergency, which goes hand in hand, and we can begin to provide some additional support in the means of the basic thing is questions and information out to the public, and come together to do that.
Okay, thank you. I have a few supervisors who have some questions. Supervisor Villapudua?
Yes, I just had a question for public health as far as shelters. I know we have 12 confirmed cases right now. And say that number were to double or triple, or even get into the hundreds. But do we have shelters or quarantine areas for these people set up? Are we working on something like that as of right now?
So are you speaking for the general population or for homeless?
No, for the people who are actually confirmed with the virus.
So during the containment phase, we were actually issuing isolation orders, but due to the increased volume of cases and the fact that we now know that we have community spread, we have moved into the mitigation phase, which is basically telling people if you are sick with flu-like symptoms to stay home and self-isolate. We do not, at this point, just as how public health works, once you have community transmission, we no longer actually issue those quarantine orders because we have other work to do as far as continuing surveillance and messaging and providing guidance. So it's all self-monitoring at this point.
Okay, thank you.
Supervisor Wynn?
Thank you.
Could I add to that? We do, as part of our emergency plans, have an Annex 8, which relates to shelters, and OES has reached out to HSA to start some of those discussions.
I have a question in regards to, which has been touched upon by other supervisors. I know that the hospitals, for example, have been communicating with each other, and I suspect because there's this fear, at least watch all the discussions by governors, et cetera, as to the availability of beds, especially in intensive care and quarantine areas, et cetera. I guess my question is the public health services, and maybe Dr. Park, but do we have a strategy in regards to inventorying our current resources in regards to beds and equipment, which is another issue that's been brought up? Because as this ramps up, and certainly with the testing, which will reveal more individuals who are testing positive, albeit maybe not sick or displaying symptoms. Do we have a plan countywide with our medical hospitals and our medical centers and any others that would be appropriate to, by stages, we know what to do when this happens or that happens? And I see Mr. Birch, I guess, along those lines in regards to prevention or at least anticipation. Are we doing anything? I assume we are, for all first responders in regards to availability of testing, certainly the equipment that may be required in certain situations, because whether it be a deputy sheriff or a police officer or a paramedic, who knows who they'll come in contact with, and are we set up to handle those situations as they occur, which probably will. So either one of you, as far as the hospitals or as far as first responders, I know those are two separate topics, so I'll leave it to you to discuss.
Chair Miller, Supervisor Wynn, Dan Birch, EMS Agency Administrator, and I also serve as the Medical Health Operational Area Coordinator for San Joaquin County. And for 15 years, I served as the Regional Disaster Medical Health Coordinator for OES Region 4. We have a very robust medical health mutual aid system in the state of California, and we've had plans in place for the better part of 30 years on how to communicate with our hospitals and expand capacity in the need that we had to surge in an event such as a pandemic. So what we have available right now is we are monitoring our hospitals on availability. We did coordinate with Region 4, which is now based out of Yolo County, and with the state of California on the disbursement of patients from the cruise line that came back and we repatriated. So we had already coordinated that disbursement of patients as necessary throughout the county. So for hospitals, for example, as part of our hospital preparedness program grant, which the board has allowed us to participate in for the last about 15 or 20 years now, we've purchased supplies and had them available as a cash in the county for a pandemic. That first part of that cash that we used and have now depleted is our personal protective equipment. So all of the N95 respirators that we had in storage, hospital or protective gowns, face shields, and other supplies, we have dispersed to our community partners, both hospitals in the pre-hospital setting, fire departments, as well as ambulance companies, as well as hospitals. So we were able to immediately offer that assistance to those entities so they could ramp up their own supply chain issues. We're continuing to process those requests to assist, but now we have to send those requests to the state and access the state cash. So the process for that is a little slow right now, and there's still some question on whether or not the state can deliver versus people having to go to Sacramento and pick up those supplies and bring them in. But even that's a finite cash. So we have been monitoring with the federal and state partners where they're trying to work at ramping up production and prioritizing the disbursement of the supply chain for PPE into the healthcare environment. So we expect that the state of California, with their purchasing power, is going to take the lead on getting some of those supplies into our systems. The larger health facilities, Kaiser's, Dignity's, American Medical Response, their own supply chains are still working and bringing those supplies in, which takes a lot of pressure off of the needs that government needs to provide to keep everybody else up and running. But we are working on that right now. One of the other things that we were able to purchase and plan for, and we did this for a variety of reasons as far as the hospital preparedness grant, is we worked with all 7 of our acute care hospitals in San Joaquin County on surge plans. And we at one time we went tape measure to tape measure and all the extra space in the hospital to determine where we could put and create a hospital bed. So we actually have a supply of portable medical beds, actual hospital beds, that we can deploy to hospitals that they can use to put in conference rooms, hallways, and other dead areas, pardon the expression, and other available space to create additional bed space to meet their federal surge targets. And we have all of those beds necessary for all of the hospitals to meet their federal surge targets. And they all have plans on how to activate those. We've actually distributed several of those portable medical beds to St. Joseph's Medical Center, who's already using them, and to San Joaquin General Hospital, who uses them to expand capacity, especially for their emergency department patients outside of their emergency department hallway in the area towards radiology. What they've done and have practiced multiple times and are very good at it. I think Dave's here, and he can probably speak to how well his staff has been able to do that. So we stand by and we're ready to assist the hospitals if we need to take those additional steps as well. For healthcare workers, the governor just issued I don't know that public health has had time to thoroughly look at all the edicts and direction that's coming down from the state, because it's coming really fast now. But some of the actions that the governor has taken is to make sure that we have enough healthcare workers in our system. So one of the directives they have for first responders and other healthcare workers now is if you've been exposed to a patient with COVID-19 or another respiratory illness, as long as that healthcare worker is asymptomatic, not showing any symptoms, then the recommendation is they stay at work and continue to work. But they take precautions for themselves, like a surgical mask or others, just in case they become infectious. That's to help make sure that we have enough emergency personnel in our systems, enough healthcare workers to provide services to our citizens. So the governor's already given us those orders. Now it's up to us to be able to actually put those into play. Our agency, yesterday, we held a conference call with all of the emergency providers and emergency medical services providers, both fire departments and ambulance companies yesterday, to kind of go through some of the directives that we've been issuing for them on how to change their practice, how to limit exposure for their own personnel, how to properly use personal protective equipment, when to use it, when not to use it. And we've been opening up the conversation about how to keep their people safe and at work. So those are some of the things that we need to follow up today and giving that further guidance out on how they are to maximize the safety of their own personnel and keep them on the job. So some of the things that we need to get out, for example, is when you go home, I'm sorry if I get kind of going on here, but anyway, we're working on that guidance to get it out to them. And I think that later today we'll have much better direction for our healthcare providers in the system forward. So I don't know if that answered all your questions, Supervisor Wynn. But.
Well, it does, but whether it be sheriff's deputies or police officers or paramedics, fire department, et cetera, they do have contact with individuals based upon the call that they receive. And my question is, I assume, based upon the tremendous amount of training they all receive, that they know how to identify a potential COVID-19 situation that would then bring in additional professionals to handle, because, as you talked about, the type of equipment that would be necessary to handle these type of patients.
The direction that we've been giving since January from Dr. Schaefer to the EMS professionals that are out in the field is to treat every respiratory illness as if it's infectious and as if it's COVID-19. So whether the patient has whatever the symptoms are, if it's an influenza-like illness, whether it's COVID, whether it's the flu, whether it happens to be another transmissible respiratory disease, treat it all the same and use full personal protective equipment when you encounter that particular patient. And that's the directive that we've been using in the community as a kind of an abundance of caution, because we always suspected, and Dr. Schaefer always suspected, that we were going to have community transmission at some point. So we wanted to be ahead of the disease curve, not behind the disease curve. So I think that has been a very positive direction that we've taken. For law enforcement, I did talk with the sheriff last week and offered any assistance that we could provide to him, to his staff, if they had questions and concerns. For their personal protective equipment, if they run out of N95 masks or gloves or other things that they need to put those requests through the Office of Emergency Services directly, because they have a different supply chain than the medical health mutual aid system does.
Thank you.
We stand by to help them if they have any questions.
I appreciate that.
Thank you. Supervisor Elliott.
Thank you. There was a brief mention of any special activities directed toward our homeless population. Is there any special outreach to them, and how do we expect to respond to that?
Yes, actually, I have been in constant communication with Adam Cheshire, our Continuum of Care Coordinator for the county, and have provided him with all of the guidance that is released daily to assure that that message is getting out to all of the shelters and all of the community-based organizations that work with the homeless population. We also have shared through that mechanism, as well as direct contact with the shelters, that we do have the capacity to send out public health educators to provide education to all the shelters, so they know how to screen, and in the event that someone is ill, how to isolate within their shelter to assure further spread.
Okay. And then do we have anything specifically oriented toward veterans and their families regarding visits to Palo Alto?
So as a veteran and a wife of a disabled veteran, I am very well connected with the veteran population and veteran services, and have been available to provide guidance, as well as I do know that all of the veteran services have now gone to telehealth to prevent the spread of COVID-19 throughout the veterans facilities. It's just another population that we have reached out to and have provided guidance to as well.
Okay, and then lastly, are we providing any particular guidance to the agriculture community or distributors of products in general? Because we certainly need to make sure that that our food and other products are still getting to markets and that sort of thing.
So that guidance is more general guidance for employers, and yes, we have provided that as well. That's basically identifying essential workers, and those that are supporting grocery stores and pharmacies and obviously healthcare are deemed essential workers at this point.
Okay, thank you.
I have a couple of questions, but I'm thinking it's either going to be for Ms. Cunningham or Ms. Lima, because it has to do with information that's coming out from regarding OES. Whichever one of you wants to pop up there.
Ellie Lima, Office of Emergency Services. I'll take a stab at it.
Thank you. So I know that we received notice that we're moving to a level 2, which is a moderate level as of today, and also that we'll be activating the Joint Information Center. So I wanted a little more detail on what exactly does that mean? What does a moderate level mean from where we've been? How many levels are there? What changes by moving to this level? And then what exactly is the Joint Information Center?
Certainly. We, on Friday at 9 o'clock in the morning, activated to a level 3. A level 3 is the lowest level of activation that our Emergency Operations Center operates at. And typically that means it's a few staff, whatever's actually needed. And we'll operate during daytime hours, and on weekends we'll revert to a duty officer status because there's not a lot for them to do. It just gets us the opportunity to really start getting some more information sharing and start to understand the situation, wrap our arms around who's doing what and with whom. The upgrade to a level 2 brings in a few more staff into the office. We open up a few more positions. We are this morning had a call roughly about 9:30 this morning with some of our partners. We're activated normally, but we're doing a lot of things by conference call, so it's not quite normal. So usually we bring everybody into the same room and we have briefings, but because of the actual situation, we're trying to limit bringing people into one room. So we are inviting people to conference calls. We had a briefing this morning to start to ramp up. So we're including positions such as planning a situation unit, finance and administration, which is a very important role in our Emergency Operations Center. We're also bringing on a medical and health branch person. HSA has been invited, ISD, in order to help us maintain the website and keep our information sharing out to the public. So if we were to ramp up to a level 3, that just brings lots more people into the room. So that's kind of the way that you can tell the difference is a level 1 is the highest level, the most people, so it usually brings everyone in the county to that one operations center. A level 2 is just what's needed, and that's kind of how we're operating. It's not a law enforcement emergency, it's not a fire emergency, but we're able, because of our incident management team MOUs that we have with the other cities and the fire districts, to bring some of those resources into the EOC to kind of help with managing information flow and make sure that we're able to cover more work with a small number of people.
Great. And then what about the Joint Information Center?
And then the Joint Information Center or system is made up of public information officers. And the good part about this is this will bring together our public information officers from around the county. We've already been coordinating with this group of folks for a while. In fact, a week and a half ago, we had a normal quarterly meeting with these folks. So we've already been able to kind of get a head start on what's going on. This helps us to bring common information to the public. It helps us to help each other to develop guidance. So now that we've activated this group of folks, we'll be able to work harder on access and functional needs, making sure that we have Spanish language and other languages that are necessary. There's a number of folks that are part of our working group that have these capabilities. We're going to be able to produce videos, live stream information. We'll be able to work with the media better. We'll be able to do public outreach on our social media accounts. And because all of the cities that are in the county are part of this group, the Office of Education, the hospitals, their PIOs are invited to participate. Now we have a much more common operating picture, and we're giving one message to everyone. And I think it will cut back on a lot of the work, and it will also help to streamline the process. And so it's a really great opportunity that we're able to bring this group together.
That's great. So I know not every city has an actual PIO or public information officer, but does every city have representation? They have somebody here, either it's someone from the city manager's office but there's someone that's taking the point for that city?
Yes, we had 32 people at our meeting, and that included people from almost several of the fire stations, the police stations. All of the cities have someone that's part of their public information system, so they've assigned someone to work with that group. So they may not be their PIO every day, but they'll be able to come in and help. And whenever you have lots of people to do this work, now we can use their skill set. So this person is really good at writing media releases. This person's really good with Spanish translation. We'll have other capabilities and be able to use their special skill sets to work a lot better too.
That's great. We've been fielding, I know I have been fielding just a ton of calls and text messages and concerns from the public specifically about this issue. We're getting different information from different places. We don't know what to believe. Is there a way we can get daily, is there a single place where we can get a daily update that we know is accurate and is specific to our county? Because that's the biggest concern. People are getting information and you don't know if it's relating to the Bay Area or if it's Los Angeles or if it's Italy or if it's, nationwide. And exactly. And so people are, understandably confused, and it's increasing the level of stress and concern. And it also increases the level of people wanting to fill the void with inaccurate information and opinions. And I think that's something that we need to really work hard at making sure that the people that live in this county have easy access. And I know I got information from 211 last week that said you can sign up through 211 for text alerts on your phone. So that's local San Joaquin County 211. So I'm assuming that they are also part of this.
So this group will be able to help us to push out this information. We are currently in the process of developing a code word per se that people will be able to text a 7 or 6-digit number to get on that list, so they will be able to receive real-time information from our public information officers. Also, we have sjready.org, which we are continuing to keep that up to date, and Ms. Nino asked us to add some more information to that, so we've been working with ISD to beef that up so it has more information about the COVID incident and everything around it. I neglected to add that the Port of Stockton and several other special districts are also part of our PIO group. The social media, it's always okay to trust government social media accounts, and I strongly encourage people to use those as opposed to some of our other, for lack of better words, some of the smaller news outlets. We can always trust our government to give the right information. So the Stockton Police Department, the Sheriff's Department, these PIO groups, the City of Stockton, the City of Manteca, et cetera, those groups are very active and are very involved in their social media accounts and giving those. We also have a social media account for Facebook, Nextdoor, and to Twitter through San Joaquin County Office of Emergency Services. The links to those are on sjready.org and also on our county webpage.
Yeah, I've been directing people to SJ Ready, so.
And also, I'd like to encourage you that if you have questions that you can't find the answer for quickly, shoot us an email. SJ Ready has a little feedback box. Didn't find what you're looking for, ask us here. And that way we will have a better idea of what do we need to get on that website and what do we need to do to fix a problem. If you can't find the answer you're looking for, then you're going to go somewhere else, and chances are you could get wrong information or still not be able to find what you're looking for. So we have to know that there's a problem. So please let us know through that webpage. It goes right to my desk and a few others, and our PIOs will be on that to fix it. That's a priority.
Great, thank you. Patty?
Thank you, Madam Chair. Quick follow-up question for you. You had mentioned that under level 2, and I may be stretching where you had gone if this is under your purview or not, but you had mentioned that under level 2, you're doing conference calls, sharing information, planning. You mentioned the word finance. Did I understand correctly? And HSA, ISD, and all that. When it comes to finance, there are a lot of questions. And again, this may or may not be through your department, but there are a lot of questions going on as far as finance, government funding, some relief, businesses, workers, a lot of things. Is that, when you mention finance, are you talking about that level of engagement, or is this unrelated to your department?
Well, I wouldn't say it's unrelated because it is part of recovery. So it is quite related to OES. Okay. As you may have seen yesterday, we are putting out a press release that the Small Business Administration, we were awarded that loan process, and that will be going out so our small businesses can get some much needed recovery assistance. There's a process that they need to go through to file for that, and we'll be able to send that information out to them. They have until December to come up with what their needs are. So there's plenty of time there to file for that. We've already been awarded it, so we don't have to do all of the research because the state of California fell into under that grant. We're able to be a part of it as a group. So that's one resource that we have that's already available. We'll be standing up a recovery page, either through SJ Ready, there'll be a link to it, or it'll be on our OES webpage. We're in the process of building that. SBA.gov, yeah, that's the small business.
Please repeat that.
SBA.gov is the Small Business Association, and that's where you'll find all of that information. And like I said, we'll put out a press release and make sure that everybody gets that, because there's a lot of information that comes with it.
And will the county have people, or will the SBA, will someone have people to help walk folks through this process? It's my understanding, I've already talked to someone that tried to access it last night. It's very complicated, it's confusing, and especially for a small business that doesn't have staff resources that have any expertise in this. Will there be actual people to help walk our small businesses through this process?
I'm not sure that assistance comes from at this point. This is all kind of
right.
new.
I know it's really new.
But we will be working that out, and I know that we've had this discussion before. I think myself and Supervisor Nguyen have had this discussion where it's really important that we help your constituents in doing that information. So the outreach will be coming. I think we're going to try to get through this early part of this right now. I do want to add something that I left out with the activation of Level 2. We're assisting with the 211 Center where we've helped public health and develop some talking points for them. So we'll be able to have 211 help with some of those calls and be able to help them with more outreach as far as the ability to take calls and answer questions from those folks. I neglected to mention that a minute ago. And I think on the rest of your questions, Supervisor Patty, in the finance and admin, we're tracking real time, how much is this event costing us? A number of our county departments have closed or canceled activities. You know that we rely on a lot of this revenue as, to help our departments run throughout the year. A lot of our parks use that revenue to maintain the parks and keep things going. So there's losses there that will be incurred. And as Ms. Cunningham mentioned a few minutes ago, $2.9 million, just under that, is our threshold for a county. It's based on population. It's like $3.84 or something per person as a loss. So once we reach that threshold, we will be eligible to file with the California Disabilities, California Disaster Act. So we will be able to file for assistance and revenue back from that. But in order to get that funding, we have to be diligent in reporting our hours and our minutes and how long we're spending on these, and to be able to report our salaries that are lost, our travel, anything that's lost, to be able to report back to that. So I'm really pushing, and we're sending out a lot of information to all of the city OES agencies, the city EOCs, asking them to be sure to document all time, all expenses, and document it correctly so we can be sure to get those funds. Because it takes a little while. 2017 floods, we just finished, we got back 98% of what was spent. And we're really only eligible for 94 because of the 6% we're supposed to pay ourselves. So that's attributed to really good tracking. So I have a lot of confidence in that finance and administration department to do that again.
Madam Chair, quick follow-up on that. Is this a county procedure and recovery, or is this also open to cities?
The county's responsible for the county recovery, and the cities will go through us. And that's part of our standardized emergency management system.
So walk me through that then. The cities need to track their losses and submit it to the county? This is very important information. I've got the cities calling me.
Important, yes.
So please.
And we are reaching out to the county so that way they have that information. In fact, that email went out this morning with the spreadsheet attached to it for how to track. And there is roughly 10 forms on that spreadsheet that need to be tracked.
Who would they contact? Who would each city contact to get this information, to get in the pipeline of this process?
Say that again?
Let's say I represent with Supervisor Elliott Manteca, and they're asking me questions. All right, so how would I steer them to participate in this process with you, your department? What do I need to do to direct them?
We have a liaison with each of the emergency operations centers that are activated, and so their liaison could send us that information, or if they have a finance person activated within their own emergency operations center, they'll work directly with our finance administration person in OES. So I would say the best way for them is to make sure that they are communicating daily with OES and that they have the spreadsheet, and they will know what you're talking about. We gave that to their OES directors this morning.
So communicate with OES and something about a spreadsheet.
Yeah, it's the financial and accounting spreadsheet, and it outlines, how much, who, what, when, where, what they did, how much their salary is, how much their benefits are, how many hours they worked. They have to sign up daily on a sign-in sheet that documents who was working in the Emergency Operations Center. They sign out, they complete what we call an ICS Form 214 and turn those in daily. And anybody that works in the Emergency Operations Center and follows their own emergency operations plan, which I know all of our cities have a well-written plan that documents this process. And if they're not sure, they should refer to that plan. Sometimes we get so wrapped up in things we forget to look at that plan. So open that plan and start to follow the process that they outlined.
So follow the city OES plan.
Yes.
Okay.
Emergency Operations Plan, EOP.
What was it?
OP.
EOP.
All these acronyms.
Exactly. Okay, thank you.
If
Appreciate
you have
it.
problems with anybody, tell them to call me or send me an email, and I will make sure that they have that information too.
Thank you.
Find anybody that didn't get it.
Ms. Lima, the $2.9 or $2.8 million threshold, there's recovery even including that amount, or is it above the 2.9? I want to make sure, because sometimes there's always questions relative to, okay, the initial cost is initially on the county and the cities, and then once we hit the threshold, it's above that. So can you just make sure that the public and the municipalities are aware of how that actually works?
Sure. We always have to understand that no funding from the government is guaranteed.
Correct.
So there is always that chance that 100% can fall on us. If we meet the just under $2.9 million threshold for our county, then 2.9 number and above is eligible for the funding if FEMA decides to provide that funding and if the state is able to provide their portion of the funding. Typically, historically, FEMA will pay 75%, the state another 25%, less their 6% holdback. And, you know, it's like the IRS, there's lots of little intricate things. But the best thing to understand is that if we are given the funding, we really need to back up our spending and make sure that we account for everything, including this meeting that's dedicated to COVID as part of our response. So I would expect all your time cards.
Thank you. Mr. Diedrich, we haven't heard from you yet, and I see you poised and ready to go. So let's.
Thank you, Chair Miller. Greg Diedrich, Director of San Joaquin County Healthcare Services Agency. I just had a couple comments. I know a lot of this is focusing on lab capacity, and I know Dr. Parks mentioned that we last week received CDC testing kits, and she mentions the finite volume and that we're able to do 60 a day. We have no guarantee that resupply, and I really want to encourage a public-private partnership. We are currently the only public entity in the county running tests, but encouraging the Quest LabCorp to ramp up the volume, as well as there's waivers for hospital labs. We have 7 hospitals in the county potentially with labs that could add to that volume. Even if we get more kits, we are running the tests. We're not collecting the specimens, and we have a capacity of 60 a day that will quickly be overwhelmed. We are following the CDC protocol. It's a CDC approved test, which requires us to receive a person under investigation number and a much higher bar to actually be able to run the test, basically somebody in an ICU bed in a hospital. And we're prioritizing those tests for the hospital such that we can turn over those critical beds as quickly as possible. But in order to ramp up and of testing that is necessary and that maybe the public is demanding with drive-through tents, we really need additional labs within the county, within the state, and there are now waivers that get around FDA and CDC clearance to have these labs run different types of lab tests than that we're currently running. Greatly appreciate OES and working in partnership and standing up the Joint Information Center. That is something that we've constantly tried to address, of how do we communicate effectively and regularly. I know a phone number was mentioned earlier, but I really want to direct people to the San Joaquin County Public Health Services website, and that is sjcphs.org. That is where we post the most current information that is locally sourced and the local lay of the land. Also, would like maybe to have Dr. Park also mentioned, we moved from containment to mitigation, but there's a lot of activity throughout the state as far as guidance restricting public gatherings and such, and a lot of people might think this is a little hyperbolic or overblown, but it's really in an effort to, you might hear in the media, flatten the curve, because if we don't slow the progression of the disease, our healthcare systems will become overwhelmed, and that's really what they're trying to do is flatten that peak in the virus spread and people having to take up the precious resources within the hospital. So maybe if Dr. Park could explain a little bit more of that. But this is, as mentioned, it's a public health issue, but it really needs to be a county-wide response, and I'm greatly appreciative of the partnership with OES.
So you say that hospitals and the other labs have the ability to also to stand up their own labs and get testing kits. Is there a coordinated effort to encourage and move forward with all of the other hospitals doing that?
There's been discussion, but that's really something driven at the state level, and it's really going to be state level clearance for them to do that. But even though we get the testing capacity within labs, there's a shortage of the collection mediums, the nasal or swabs, and those test mediums. So there's a shortages and needed prioritization throughout the entire system.
Thank you. Dr. Park, want to respond to Mr. Diedrich's request?
I believe Mr. Dietrich is asking me to speak about containment versus mitigation. The curve.
Flattening of the curve.
Flattening the curve. So I've seen this curve everywhere, and I'm sure you have. And basically, the curve shows that if we don't do all of this social distancing and washing our hands and all these prevention measures, that we are likely to have this very high peak. And if we have this high peak in incidence number all at the same time, we have a surge in our hospitals, and we are going to overcome the capacity of our hospitals all at once. And that would be quite disastrous, because we're already overloaded and congested, as I said, in many of our hospitals. So by flattening the curve, that means maybe we'll have a large number of cases, but those cases will be spread out over time, because we'll be making our best efforts at what we call mitigation, so that not all at once would all the hospitals and all of our healthcare facilities be impacted. By containment and mitigation, what we mean is we are moving into mitigation strategies. We have evidence, as I said, out of the cases that I told you about, of at least 2 examples of community spread. So we know it's in our community, people who had it without the contact history or the travel history. And knowing that, we decided last Thursday to move into mitigation, which means instead of focusing a lot of our effort and time, which was an enormous amount of time, into tracking down travelers coming in from China, and into tracking down people who think they might have been exposed to COVID, and doing a lot of contact investigation, we're now really trying to focus our efforts at public health on the people who are most vulnerable. That is, getting the messaging out to the elderly and those with chronic medical conditions, and on all these mitigation strategies, which we think would still work with all the preventive actions that we've been asking people to take. So by doing mitigation strategies, we're hoping that not just San Joaquin County, but all of California and all of the country makes this massive effort towards flattening that curve.
So I have a question. We're trying to maintain distance, and we're trying to encourage people to self-isolate in some cases. So we have 45,000 people that commute over the Altamont every day into the Bay Area, and a very large number of those from San Joaquin County go into Santa Clara County, which has been one of the hardest hit counties. And the bulk of those people are commuting on public transit, on trains and things like that. Do we have a plan in place to, I know those ACE trains are full every day, so there's absolutely no way that currently they're maintaining a 6-foot distance or able to do that on those trains. Do we have any idea? Is there a way that we're coordinating with the transit providers and with our commuters?
Right, and of course the governor did say that transportation is a function needed for people to get to work, of course, but of course we're still trying to put that messaging out that even transportation businesses like buses and train lines should do their best to distance people, just as we've asked restaurants to distance consumers by 6 feet. That is the goal, and it may not be realistic at all points in time, but I am imagining that there will be less and less traffic into the county as those counties that feed into ours start to shelter in place and take other drastic measures of their own.
Thank you. Supervisor Patty?
Thank you, Madam Chair. Great question. So yesterday I went to Kaiser. I had a doctor appointment for something. I walked in and somebody instantly gave me hand sanitizer and screened me and asked if I had any cold symptoms or temperatures or anything. So there was a definite profile before I entered into the facility. Can we, or are we, in discussions of doing something like that when the train does pull into a station? You've got conductors, there are people that are boarding the train. Could we enact some sort of screening process?
That's a good question, and at this point, many of our hospitals already enacted their own policies of screening for fever and symptoms as you enter, and as I said, we now have health officer orders asking that people please not visit the hospitals unless there is a definite need, and the governor did say don't visit hospitals unless there's an end-of-life care issue and you need to visit a loved one. As far as trains and transit, we have not engaged with that yet, with that conversation.
I know airports are doing that. Some airports, before you're allowed in, they're doing temperature screening.
Yes, and a lot of people have taken this on themselves without any orders from public health or from their health officers. People are just following suit and doing their best to comply with regulations and guidance coming from the state. And so I would think that over time we would have more and more people asking these same questions. And as we receive them, we will be giving guidance to people, businesses alike.
Just as a quick follow-up, I'm wondering if we should be proactive and talk to ACE and since that is a mass transit and there's a major corridor of commute on a daily basis with thousands of people, if we should be discussing with them their protocol and what they can do, and even if there's a county request or a county directive to do such. I'm not sure what's legal here, but just a little action of preemptive measure may go a very long way.
And thank you very much for that thought. Sienna, did you want to say something?
Yeah, Sienna Blackwell, Rodriguez, Public Health Director again. That was the whole intent of the declaration of emergency countywide and the implementation of the Joint Information Center is so that public health has additional resources in getting that messaging out. So that is definitely on the list that we will be working together with OES to further message to other entities.
Okay, thank you.
Great, thank you. I just want to invite Jolina Voorhees up for some information. And then after that, Mr. Culberson, if you have any updates that you think it's important for the board to have in regards to San Joaquin General Hospital, you can follow Ms. Voorhees up. Thank you.
Yes, I just want to mention to the board that Jolina Voorhees, Deputy County Administrator, that there was a lot of legislative action last night at the state legislature before they recessed until April 13th, that they passed the funding package, SB 89, which was a budget bill for COVID-19 to provide $500 million in funding, which can be increased, and 50 million increments up to, but not to exceed 1 billion, which can be done over the phone by the Joint Legislative Budget Committee because they're not meeting, of course, because of coronavirus. The bills, this is going to address some of the questions that have been raised, which is why I wanted to tell you about it. The bill's funding will enable leasing and activating two hospitals, providing hotel beds for people experiencing homelessness, cleaning child care facilities so they will remain open, acquiring hospital and public health surge equipment, assisting hospitals and nursing homes, funding IHSS, Adult Protective Services strike teams to support senior isolation. So I just wanted to be sure people knew about that bill that was just passed last night. I don't believe the governor signed it yet, but I'm sure will. But it's just, it changes almost every hour. But the governor did a executive order last night about evictions and foreclosures. So as soon as I get that information, I'll be sure and pass it along to the board. But just wanted to let you know about that funding measure that was passed last night.
Great, thank you. Oh, I'm sorry, Supervisor Elliott.
Thank you. Just some follow-on information to the question about what can we do about the crowded ACE trains, et cetera. So the ACE folks, the Regional Rail Commission, have been looking at that particular issue as well. Some initial information is that ACE ridership has been dropping with each announcement in Santa Clara County for employees to work at home and employers to allow more flexibility that way. There was a 40% drop in passenger riders last week on the ACE service. So some of that is occurring just as a result of what the employers in Santa Clara County are doing. And then they're also looking at other things as well to reduce the size of the trains and encourage the recommended 6-foot spacing between passengers, that sort of thing. So they are looking at ways to implement as much of these common sense measures as possible.
Thank you. Mr. Culberson?
Chair Miller, good morning. Members of the Board of Supervisors, David Culberson, CEO, San Joaquin General Hospital. Yes, happy to report on activities we have at the hospital. Basically, since last week, we've convened about an hour and a half to 2 hour meeting every afternoon. We start at 3 o'clock. It includes my infection control practitioner, my medical staff leadership, ancillary support team, nursing team. Really, we take a look at everything. We're analyzing the patients who are in-house or who have come through that have been tested or maybe need to be tested. We have sessions on education, making sure that we have adequate training going on, and if we find there's some areas we need to do some more, we make sure that we have 3 or 4 nurse leaders who are doing training for us, including our infection control practitioner. We have continued to take a look at all of the supply chain activities, as echoed by Dr. Park. I think there still are some things that we need to do, and also working in conjunction with Dan Birch at EMSA, making sure that we evaluate and request items that are there, whether they're isolation gowns, the N95 masks, face masks. We actually are evaluating on a daily basis every morning. We get a run of the current inventory as well as where we can assess then where we might be short. I will say that over the last couple of weeks, we have had runs on everything from the N95 masks to the patient gowns here and face masks here, with assistance from Dan's team, and now moving on to the state level, we in conjunction with our local suppliers. And I think that's one of the things, fortunately, being where we are, as our county is a distribution hub for a number of medical supplies. We if they are close by, we can get them. And if they're available, because they're close by, we can get them, and that's something that is very, very much important for us. On Monday, we established a drive-through clinic. It's appointment only, and we have to have a visit of a virtual visit on a telephone with a provider before we can make an appointment. We saw 25 patients yesterday. I'm told demand is pretty high, but again, we're not in the business, and Dr. Park and CDC have made it very clear we are not testing asymptomatic patients. You need to have a consult with your provider, who then will, and of course we have a number of physicians. Our family medicine team is handling that for us, and we have put together a process for mobile drive-through. I believe it's from 10 a.m. till 3 p.m. As Dr. Park and Greg pointed out, we had 25 tests yesterday. If there's only 60 available, that could overwhelm the system. So again, as we laid out, it's very important that we continue to grow the testing capability within the state. Let's see here. Oh, we have also then Dr. Park introduced yesterday declared or issued a guidance on visitation, and it's very, very restrictive. I acknowledge that it's not something that folks want to have. We actually started it yesterday afternoon and had a number of visitors who were, of course, not aware of it, but it is essential that we do here. Only very, very limited availability of visits to the hospital. We have reached out again in conjunction with guidance by the state and CDC, also then scaled back a number of the clinic visits that we had, particularly on routine follow-up medication, ongoing maintenance medication visits. We're trying to working with Dr. Fadu, Health Plan of San Joaquin, to implement televisits that are there. We've increased, I think as of yesterday, we kicked off a very extensive Zoom, enabling a link to be sent to patients and then to click on, and either through their phone or through a desktop PC would be able to have a consult with their provider, at which point then we can continue on the maintenance med if necessary. And of course, if you really do need to come in, we are seeing you, but substantially ramping back the volume of visits. I think we saw roughly half of the normal visits that we had as of yesterday. In terms of other things we're working on here, we have always have had a surge capacity training, and we made sure we dust off that plan. I've got an active nurse manager who handles our surge training. We have also then started, and there are available waivers through the state to go ahead go into non-traditional areas. We did inquire last week, not necessarily with the state, but with our association, California Association of Public Hospitals, the opportunity, perhaps if necessary, of going back into the tower building, the 1932 building, and again, given the appropriate waiver, the appropriate requests and blessing by the state, that's something that we will pursue. We're beginning to pursue it now. We aren't going to wait until we get full in the event that we do get at capacity. Some of the other hospitals in the public hospital system have indeed already requested and been granted that if it gets to that point. The thing that we realize is going to be the shortage of, and I know Supervisor Patty asked about personnel. We have capacity for space to some extent, but the licensed personnel are going to be the challenge. And so we're doing our best to make sure that if you are symptomatic, we send you home. Again, Dr. Park has put together a very, very easy to follow guidelines on anybody that is symptomatic, how we test, we self-quarantine, and based on some guidelines actually that the state started this morning on a conference call. We'll make sure that we follow those guidelines. So really being very proactive. We have had some exposures of both at least faculty and medical residents that we know about here. We did get some results back of them. Half were negative and the other half are still pending. So there indeed are exposures occurring. We follow CDC guidelines for droplet precaution, for infection control. This in many ways is exactly the way we train for tuberculosis. And as you know, in our community, we have had over the years a higher than other county rate of tuberculosis. So our practice that we have for TB is exactly what we're using for COVID-19. Lastly, I guess from another perspective, we are taking a look at what other ventilators we have. We have upgraded our vents in the last several years, but we have the old ones that are in storage here. So we're making sure our biomed team starts working on them so that we have, if needed, the additional ventilation capability. There's a lot going on at the hospital. I want to say you've got some very, very dedicated employees that are coming together on behalf of the county. And I can say I'm well aware of the activities the other county hospitals are having, not just San Joaquin General, but working our tails off as essential community providers for preparation and, if necessary, a greater response than we have. Any questions that you may have?
Any questions for Mr. Culberson? Thank you. You and your team, you're going to be right at the heart of this going forward. So please know that you have the support of this board, and we will do everything we can to make sure you have the resources that you need to do your jobs.
Thank you, Chair Miller. Yeah, we have one additional thing we have started. We've limited the number for those employees that are coming in. We're limiting the access in them, and they will have to all be screened for their temperature first thing in the morning. So that's something, I'm not sure we got it up today, but we hope to have tomorrow morning. So again, even employees, we're going to be testing employees and visitors, the limited number of visitors that are coming on site, we'll make sure we test it. We'll certainly appreciate your support. Thank you.
Great, thank you. I have just one last question, and I think it's going to be for Mr. Diederich. One of my takeaways from all of this is we need more testing kits, and we need the capability of being able to process those kits more than the current 60 a day that we're doing. So it's kind of two-part. Are we on top of making every effort to get those kits through whatever means possible countywide? And secondly, does our public health lab, do we have the capabilities, the employees, the staff, do we have the capabilities to ramp up? And if not, what can we do to make sure that we get it?
So we have gone to 7-day-a-week operations to support the need. We have filed the request and received approval for more test kits, but have not received confirmation for when we receive those. We have also actively called back any of our retired lab personnel that have already completed paperwork and are starting this week to add additional resources. We have also been in contact with the state laboratory training system to actually utilize, I'm sure that you are probably aware that our lab does host that training, and so we have received permission to use the trainees as our employees as well to meet the demand of the COVID testing.
Great.
And we are, the capacity when we mentioned 60 a day, that's an AM run of 30 and a PM run of 30. So there is some constraints on the actual equipment. That could be ramped up if we actually extended our hours. But until we get more test reagents, we could be exhausted within the next 10 days. We are running the CDC-approved test, and as I mentioned, other commercial labs have access to other types of tests. I'm not a clinician, but I also understand when I mentioned that there was a shortage of collection mediums and the swabs. Maybe Dr. Park could mention this, that there might be some movement of only taking a nasal rather than an oral swab, just because there's not that many swabs available, and those the test mediums that are transported to us in.
So the test in the very beginning phases, the CDC was asking for upper respiratory, lower respiratory specimens, stool, urine, and serum, which is blood. So upper respiratory meaning a nasopharyngeal swab, which is a plastic swab that goes up, kind of like when you get a strep throat culture done, but a different stick that would go up through your nose and to the back to try to get some sample and get as much secretions as you can. You leave it there for a few seconds and then bring it out. It then goes into a vial with juice, and that's the viral transport medium. And initially we were asking for the nasopharyngeal and oropharyngeal through the throat, serum, blood, urine, stool. And all of those other things dropped as we realized that nasopharyngeal and oropharyngeal swabs were quite sensitive and specific, and so the rest are not actually needed. Sputum can still be collected from somebody who is having a productive cough, but most people with this illness have a dry cough. So in the very beginning, we were doing nasopharyngeal and oropharyngeal in 2 separate vials. But because there are shortages and because there's a lack of viral transport media, we are now given permission by the CDC to collect both swabs from the nose and oropharyngeal and put them into one vial with the juice, with the viral transport media. And that has even been reduced to saying that you can do just the nasopharyngeal or just the oropharyngeal. There is some controversy as to which one is the better test to do, so our lab personally feels that getting both and putting them into one vial is still the best, because they're seeing that through that they're capturing more positives. So that would be our advice at this point.
We are doing everything to assure that we are getting more of the reagents from the CDC-approved lab, as well as working on our partners to make sure that we can run the labs that are presented to us. And hopefully, as I mentioned, we're prioritizing those towards hospitals and in an effort to turn over those critical hospital beds as quickly as possible. So, as mentioned by others, we're not the lab that's going to be testing widely for asymptomatic and in the community. Ours is in support of our healthcare delivery network.
Thank you. And follow-up?
Yes, I do have a follow-up. Thank you, Madam Chair. I know we have a lot of questions coming at you. Just constituents are reaching out to all of us, and a lot of questions, a lot of unknowns. Dr. Park, you had mentioned that there's an estimated potential of 2 people per 1 infection, 2 people being exposed. And we're putting in some, and I'm not putting words in your mouth, so you may correct me and share more information. But we're putting in some recommended modifications to how we're interacting and what we're doing socially in restaurants and limited exposures. Is there a model that we can foreseeably project the curve to go based on other models that we've seen with other countries or other municipalities have done that we are replicating, so we can kind of see where we might be going and what we might be able to anticipate?
And thank you for that question. There are people developing models, and I'm getting emails every day from people who want to sell me their product, which will help me track my county. And so we might be looking into some of those options. There's definitely models that the state and the CDC are using, but locally we have not bought any of those tools at this point. But yes, they are out there.
So do we have any projections based on what we've seen? Like there's other countries that they've isolated and quarantined cities, and in the 2 or 3 weeks that they've done that, they've seen an explosion, they've seen a flattening, they've seen a decline. Any knowledge based on what has been seen by other practices?
I can't make any global predictions as far as any models go, but I will share with you my hope is that we have initiated a lot of this social distancing, school closures, bars and wineries, before we started to really peak and before the other counties that have now shelter in place. We were at a timeline similar to them when the governor initiated these closures, and we initiated closures, yet they were much further into their caseload at the time. So my hope is that we have really initiate a lot of these social distancing measures on our timeline earlier compared to those other counties. And so that maybe, although you might see on the news that there's all these models of people tracking the upward growth, I don't know how that will affect our local statistics, and I'm hoping it will have some effect on ours. So I don't have any specific predictions for you.
Right. But so far, it looks like we're a little bit ahead of what some people, the actions some people are taking now, we are doing a little bit ahead of their curve.
I feel that we are. We had our schools make announcements on Friday that they were closing. We had the governor making announcements that we were going to be restricting mass gatherings. It went from 250, then we heard from the CDC 50, and then President Trump saying 10, and bars, wineries, brew hubs closing, restaurants using social distancing practices, our limitation on the hospitals. There's so many efforts and so much guidance, and I really do see that most of our county's residents are taking this seriously and following the guidelines. But when those guidelines came in and we started initiating all of this, we really only had a few positive and confirmed cases here in our county. And so I think our timeline is a little bit shifted as compared to the timeline for some of our counties to the west.
Okay, thank you very much for that.
Thank you. Any other questions from the board? Win?
The 6 Bay Area counties have adopted a very strict guidelines for gatherings, which don't even talk about numbers, to the point where they flat out say that, you know, you can't have somebody over for dinner, don't have anybody hang out at your house, etc. I think the part that maybe troubles me the most, though, is their particular ordinance carries a criminal penalty of misdemeanor. I'm not suggesting that. But my point is that I know we're getting a lot of direction from the federal government, CDC, certainly the governor and the state, you know, public health. And I guess for Ms. Lima, in regards to her notification, et cetera, I would hope that as we provide this information on a daily basis, because it does change almost hour by hour, that one, we certainly talk about, as you alluded to, we talk about San Joaquin County, what's happening here, because, you know, that's our main concern, not what's happening in New York or other places. But also, I think one of the most helpful things is sometimes when we talk about these restrictions, that we also attribute to where they came from. That it wasn't necessarily the county that adopted them, it was a state order of the governor, et cetera. Just for information, just so people know, because I know sometimes when things are restricted, people complain and they point to the county, or whether it be you or us or whatever. And so I think we need to be totally transparent of why these things are coming, that we really have no choice, although some people have told me, well, we need to tell the state to go pound sand. Well, that's not going to work. So anyway, I just appreciate certainly your efforts, all your efforts, in regards to making sure that the public has access anytime they want as to what the current status is, the current numbers are, certainly the restrictions. And as I talked about earlier, I think people are smart enough to figure out that, you know, it's in their own best interest to follow these guidelines.
Thank you. And we are going to make our best effort to update daily our website with the real-time numbers, and we will be sharing that with the folks who run SJGov.
Great, thank you. I know I watched the governor's press conference on Saturday, and I was very pleased to hear him say he was really pressed. Why isn't this, why aren't these, why are they only guidelines? Why aren't these orders, and why aren't they statewide? And he was very, very articulate about saying we are a very large state, and the situation is not the same from county to county. And that's why we're issuing guidelines and making sure that our counties have information on what best practices are. But we trust our local government to ascertain their own situation in real time and make decisions for their own residents. And I think that's really important. It's exactly what Supervisor Wynn is talking about. I think it's really important if and when we begin adopting more of these measures to make sure the public understands why we're adopting them, what's changed. Why are we now moving from a level 3 to a level 2? Why are we, why did the County Office of Education make the decision to recommend to the districts school closures? Although even in that case, it's my understanding the actual decision was left to the individual districts. So I think going forward, I think that's a good plan for us until it's not. In which case, then we'll make the decisions. So thank you all. This was extremely informative. I'm pleased to see that we have record here reporting. And I'm glad that this is being streamed. Before we move to taking action, I want to ask the clerk of the board, have we received any public comment online?
Yes, we have. Actually, I've received almost a dozen comments online.
Wow, great.
Yeah. I think a lot of the questions have been answered here today, but I'll read each of the comments, and then it's up to the board if they want to hear responses to those questions. So from Michaela Allen, she asks, most of us all just want to know if we are going on a shelter-in-place or a lockdown. Phil Johnson, president of the Sims Group A Management Corporation, he asks, what is your opinion on property taxes that are due April 10th? Will we be getting a postponement? What is the instruction for restaurants that want to remain open? If we go into a lockdown in San Joaquin County, will we be allowed to have private security to protect our properties and customers who are shopping at our grocery stores and banks? Will we be able to have limited maintenance department staffing to allow for cleanliness in and around the properties for the protection of the customers? Thank you for your consideration from the Lincoln Center and Parkwood Shopping Center management staff.
Let's maybe take those first two so we don't get overwhelmed.
Sure.
Dr. Park, are you the person to ask on the first one? Are we moving to a shelter-in-place or
I would
lockdown?
be the person to ask. And so I've put some considerable thought into this issue as I saw the 6 counties in Santa Cruz make that decision yesterday. And I did look at their numbers and their timelines. And the hub is really Santa Clara County, which now has 138 confirmed cases and at least a couple of deaths. And the surrounding counties all agreed at once to go to the shelter-in-place activity in unison. Looking at their timeline, as I had said earlier, when they had about the same number of cases that we had, it was March 2nd for Santa Clara County. That was when their number matches the current number we have now. Subsequent to March 2nd, I will tell you that on March 12th, which was last Thursday, is when we initially got some guidance from the CDPH to limit mass gatherings to 250 people or less and to start social distancing for smaller gatherings. At the same time, right around the same time, last Friday, March 13th, is when San Joaquin County schools announced all of their closures. Also on March 13th, San Joaquin County Public Health Services, following the guidance from CDPH, released our own guidance, mirroring the state's guidance on mass gatherings of 250 or more. Then on March 15th, Sunday, the CDC issued guidance to limit gatherings to 50. Also on March 15th, Governor Newsom then called upon bars, wineries, and brew hubs to close and for restaurants to practice social distancing and offer food delivery instead. March 15th as well was our order to the hospitals to restrict visitors. And then on March 16th, just yesterday, the president said that we should avoid gatherings of 10 people or more. As I look at this timeline, with all of this messaging going out, I do see that the folks of our county are heeding this advice. Nobody wants to shake my hand. Nobody wants to stand within 6 feet of me. And I see that my street is very quiet. And I will tell you that I believe, just as the governor believes, that although this is a guidance and not an order, that people are taking this quite seriously and they understand that the whole concept of flattening that curve. And I do believe that people are really honoring the guidance coming from the CDPH and the CDC. So when you look at this timeline, as I said, the guidance on mass gatherings that came out last Thursday, March 12th, we made our announcement that we had our first case on March 10th. And on March 12th, when all of these guidances were coming out and people really were canceling their concerts, their conferences, their parties, right around that time, we were at a case number of 3. At that point in time, the counties to the west of us that are now in shelter in place were well into their double digits, and they now stand right around 40 and up to 138, as I said, for Santa Clara. I do believe that if you look at our timeline, as our caseloads went slightly up each day, the guidance came out more and more restrictive. And as the public is following this guidance, my hope is that we will see our own local flattening of the curve with as many closures as we have made without having to shelter in place. So I have no way of saying or knowing for sure that that is not in our future. Nothing is off the table right now, but at this point in time, I do believe that our timeline is moving along at a different rate and a different time. And when all of these guidances came from the state and from the federal government, we were not that deeply into having community spread as some of these other communities have been. And so I'm hoping that the measures that we have taken so far are impactful enough that we won't have to consider that further option.
So is there a difference between, or are people using the phrase interchangeably, lockdown and shelter in place?
I honestly don't know what lockdown means because the health officer orders are for shelter in place, and I think lockdown is more of a layman's terminology for that. But.
And I would just comment, this is Greg Dieter, Director of Healthcare Services Agency. If you looked at the orders from the Bay Area counties, Section 10 has very broad exemptions for who could go to work or not. I mean, it's as broad as if you're a construction worker or building affordable housing, you go to work. If you look at that order and specifically to the comments, yes, you would be able to post guards. You'd be able to basically have staff cleaning your facilities. So if you look at all the carve-outs in that order, it's not a blanket order that 100% of the population is has to stay in their own house.
Right. And are there still, even if it's shelter in place, you can get out for, I'm assuming, still food, prescription medicines, doctor visits, anything like that?
Yeah, so all of those that you just mentioned are basically able to do. You can go do your grocery shopping. You can go to your medical visits. If I'd encourage people to actually look at that order. It's not as it's not where everybody has to isolate it and cannot leave their house.
Right, which then means if people are able to go grocery shop, that means that people that work in grocery stores or at any part of the supply chain, they're also able to work so that people can still have access to food. Same thing with health care.
Yeah. And it goes to flattening the curve. And when Dr. Park mentioned the R naught, this is really trying to get it less contagious. That one person, it will quickly die off if one person transmits it to less than one person.
Correct. Okay. I think we've answered what came in so far. Do we have some more?
Question of taxes.
Oh, yes, taxes. I don't know who's going to answer that one.
At least on the state side, the state treasurer just announced that the taxes wouldn't be due on April. They would be delayed by 3 months on the state side. I'm not sure about the federal side.
I thought that was income tax. I didn't think that was property tax.
So let me share with you. I believe it was State Board of Equalization. I want to say I read it. So I do not believe that was property tax.
No, I don't think so.
And I would encourage this board to delay any decision in that regard at this point.
Also add the governor's proclamation dated 3/12, executive order number N2520, under item 5 and 6. And I think there was one other item, mentions the IRS office, the franchise tax board, and the revenue and taxation codes that have been softened and delayed by 60 days. And so their webpage will have more guidance on that. And I would actually encourage folks to look at the specialized guidance under cdph.ca.gov under their documentation guidance page. There's a number of things, and that's one of the things that is covered.
Yeah, and that's the Board of Equalization. Exactly. I also have confirmed as of yesterday that the federal IRS is not delaying payments. So everybody, April 15th still matters. So, and on the property tax, I think that's an issue that we'll keep an eye on. And if we need to bring an item to the board to look at that, then we will do that.
Anina McBride writes, X-ray and nursing students are still attending classes at the hospital when all other schools have been canceled. They are performing chest X-rays on coughing patients without full PPE. This seems like a major liability for the county. Will someone please look into this?
Culberson?
Hi, good morning, Chair Miller, members of the board. Yes, I think the answer is yes. Everybody who is seeing patients has been educated. I do know that a number of the student programs, the medical students now are no longer rotating through. So I'll check with the program and diagnostic imaging program, and then specifically look into where we are on training of the students. Yes.
Great, thank you.
Rhodesia Ransom, Councilmember City of Tracy writes, thank you for your leadership at this unprecedented time. I realize that things are coming at us quickly and changing minute by minute. However, as an elected city official, I would like to ask for your help. Our constituents are looking to us for information. I am in frequent communication with other councils, agencies, and my own city manager. We are finding ourselves scrambling around and making individual calls to our networks in order to get information that our constituents need in order to stay calm. As they watch their communities go to shelter in place and hold press conferences to provide information, I am finding they are becoming anxious because of the unknown. Can we please get a daily brief, email, or more frequent communications about how state executive orders are impacting our decisions or communities so that we can push that information out? There are concerns that the report of only 9 cases in the county is underreported. Can you please explain to the public how we are gathering that information? As example, what are the hospital requirements for reporting? Are you legally able to tell us what city individual cases are located in? The goal is not to create panic, but to provide an awareness that will help the community govern themselves better. Lastly, can you clarify what level 2 moderate activation is and provide detail about the Joint Information Center? And I do believe that that came in prior to the discussion that did answer many of those
Some of those did, in terms of also, Supervisor Patty asked about, do we know where the cases are? We're very tightly regulated in terms of patient privacy, right, that we can't do that. And I'm assuming that on her communication questions, that's been answered by Ms. Lima in terms of moving toward activating this the Joint Communication Center and this process. So there will be daily updates, and we are going to be directing people to sjready.com and .org, sjready.org, and also sjcphs.org. And there will be daily updates there. And then we will be, since all the PIOs are part of this, they have the responsibility of pushing that information out into their respective cities and agencies, correct?
As we're speaking, they're setting up a schedule for when that information will be shared. So that way we have a timeline and we know that every day at this time we can expect to get an update of what's going on. And they will have constant communication because they will be embedding someone in our EOC. That's part of our level 2 activation.
Excellent. Thank you.
I'd like to address the question about underreporting of numbers, if I may. At the beginning of this illness and all of last month, we were the only way that you could obtain testing. Not that we were doing the testing, but it came through public health that you would get this PUI number, a person under investigation number. And until we called the CDC, discussed the clinical case, and had a patient get assigned a number, the test would not be run. So I don't think that we have any underreporting of numbers because we know exactly which cases we were getting these numbers for through the CDC, which ones were approved for testing, and we were the lab, the only lab in the county of public health that could then send the specimen out to the CDC. So that was going on for the whole first month of this disease. Then the California Department of Public Health opened up their VRDL, their viral and rickettsial lab in Richmond, California, a few weeks back. And we were able to then start sending samples to them and not to Atlanta, Georgia, to the CDC. But still, those samples required that we got a number assigned to that patient specimen by the CDC. So that all had to go through public health. Without that number, the specimen could not be run. And so we were on top of knowing which specimens we were sending out to the CDPH as well, because we were the only avenue through which these specimens were being sent out to the lab's processing. Now, as of last week, as I said, our own internal lab is doing some testing, so of course we know what our own numbers are as well. Last Monday, the commercial labs, including labs such as Quest and LabCorp, did gain access to their own testing reagents, and some of our local healthcare facilities are sending their specimens to those commercial labs, but they are mandated to report to us any positive number. So the last 3 that were just added on to our total count of 9 is because the hospitals and healthcare facilities and doctors are mandated to report this. It is a law now that they report within 1 hour and fax to us what's called a CMR form, and they are doing that even if the lab specimen is going to an outside commercial lab. Labs are required to report to the state, and doctors are required to report to public health. So I do believe we're quite accurate on our numbers, and I wanted to give that reassurance to Councilwoman and Tracy.
Great, thank you. So you said a minute ago 3 additional 12, but earlier I jotted down, you said 13 cases.
We are now at 13. The 3 were from Quest Labs from a healthcare facility that reported to us that they had positive results from a lab outside of ours. We are at 13.
We are at 13 currently. Okay, thank you.
Thank you.
Madam Chair, I do have a response from the Assistant Treasurer Tax Collector Wyman. He writes that due to public health concerns, they are encouraging taxpayers to make payments online, by mail, and by phone. The Governor and the State Controller's Office has not extended the property tax delinquent date of April 10th at this time. If there are any changes, they will update the information on their website and also issue a press release. And then we have a comment from Interpol Surrey. He says, hello, I would like the Board of Supervisors to consider a shelter-in-place order. The difference between the Bay Area and our communities is small due to the amount of commuters. It would make sense to do so now rather than wait for more cases to be confirmed. Our hospitals have been running at capacity before the outbreak. David Yoakum writes, are there going to be any restrictions implemented on public interactions, or is it business as usual?
I think both of those have been discussed.
Leandra Long writes, hello, what is the recommendation for gatherings? Limited number? I've seen 250, 50, or no more than 10. Is there exemptions for certain businesses, etc.? John writes, I have been with SJGH for the last 36 years. We all are praying we don't get slammed with health issues from corona. It's more concerning we have totally incompetent leadership in administration and medicine. This leadership has blew up $120 million in 5 years, and last year only negative of $37 million by adding more on trauma service that is working below par in all aspects. Total recruitment for new services like trauma and neurosurgery is $55 million, and they generate next to nothing. Medicare reimbursement is 17%, while national is 23%. This is due to denial of frivolous surgery, unnecessary surgery. If we need to survive corona, we need capable and genuine physician leader in administration. Good luck to all, John. And Justine Orion writes, why has San Joaquin County not issued any protocols for county workers in relation to the coronavirus? Protocols have been established nationwide, statewide, and citywide, but the county continues to expect 100% compliance with work and will not allow remote work because it is against county policy. This is reckless and punitive behavior which will ultimately have negative effects on our community. For example, social workers are expected to conduct 100% compliance visits, face-to-face, in-home, no pre-screenings or any protective measures in place. Social workers work in close proximity to each other in cubicles. All it takes is one person. It is clear that this is a punitive response in response to the recent strike. And that is all I've received so far.
Thank you. I'm going to see if our CAO wants to answer that last one.
I can definitely answer the last one. So yesterday, I sent to the department heads some precautionary steps to protect our employees and our residents. We gave departments the flexibility to evaluate non-traditional options to safeguard employees and residents. And so at this point, I wrote right in the letter that we are continuing to operate as usual, but as departments, we've had some departments do, especially those that have some employees that have some risk as a result of both age and health-related complications, to be able to work remotely. We've also allowed alternative work schedules. We've also suggested to department heads where necessary, if we have folks who need to provide childcare to their staff, that they should be consider liberal time off when it comes to using vacation and various holiday leaves. And so I know, because I was with Mr. Woods yesterday in our normal monthly meeting, I know they've been able to reduce significantly, I heard almost 50%, the public contact at their counters as a result of not requiring some of their interviews to be done face-to-face and to be able to do them both on the phone and digitally. So far, I know our department heads have appreciated the flexibility we've given them. Another department head I spoke to was Child Support Services, because I was also hearing last week, Thursday and Friday, and as we heard from one of our in-house experts, that people are taking the concern about staying home and, not necessarily having as much public contact, that our lines have gone down significantly. And so at this point, we are not recommending to close to the public as the city of Stockton did, but we are giving departments the flexibility to put in place as needed what is needed for to provide customer service, because the county is very different than our respective cities. We provide a lot of services that our county residents do need, and we've allowed our department heads to do whatever they need to do online, exactly as our assistant treasurer tax collector, recommending to utilize those online services, make those phone calls, and if we can accommodate our clerk recorder, they're able to do some work remotely also, and their goal also, because they're also a heavy traffic area within this building, they're allowing some of that work to be done remotely.
I know that at least one of our departments as well, they've moved their lobby or their interaction with the public, they're moving to appointments. So they're allowing people to set up appointments online, and then they can come in. So it's they're able to maintain the social distancing as opposed to people just coming in whenever it's convenient and appearing at the counter. So I'm glad that some of our departments are implementing some of these procedures. Mr. Diedrich, did you?
Thank you, Chair Miller. I appreciate the flexibility the county's having, and I know one size does not fit all for all the different departments. And obviously, if you're sick, we need you to stay home. But we're also county disaster workers, and in order for our public health and other healthcare deliveries within the county, we need workers to present and be at work. And I know some of the guidance from the state, it is not specific to county government workers. Specifically, there's some desire for individuals that are over 65. If they don't have a comorbid health condition, the guidance is if you're just over 65, specifically if you're in a healthcare delivery, because we need those healthcare providers to be providing care to critically injured individuals. We need it within the public health space to have our workers at work. And this is broad because if you might be in an area that is, let's say, child seat safety, that might not be a critical area, but I could use that same individual to staff a phone line.
Thank you. Okay.
Yeah, before we make a motion and close out our meeting, I did have a question from a constituent came in for County Council. So we've got recommended courses of action. We've got suggested occupancy deductions for restaurants and some closures that have been pretty much requested by the governor. What's the enforcement mechanism? Some businesses are really challenged by outright closures, and some can adopt and do fine with 50% occupancies. Countywide, what's the enforcement mechanisms, or how much autonomy does a business have to operate in San Joaquin County without repercussions if they want to open up their doors and receive people from the public?
So I won't give legal advice to the businesses in the county. I'm your attorney, not theirs. But to respond to your question, the orders that are made both by for the local emergency and also to facilitate the local health emergency, those orders can be enforced by the police. Violation of those orders can be a misdemeanor. The guidelines that have been issued by the governor, as Chair Miller has indicated, the governor has been very clear that he has issued guidelines on a number of instances, cities and counties, to determine the level of escalation that's appropriate for their municipality or for their locale. Those guidelines in and of themselves are not enforceable, but certainly businesses as well as individuals need to be responsible in this time to help prevent the spread of this virus.
Okay, and as a quick follow-up on that, it's a great point. Thank you. So we have wineries in Lodi. There's not a lot of wineries throughout the state of California, so we have wineries in particular here in Napa, wherever. So these are guidelines. When it says a winery has to close, that's not a law, that's a guideline?
My understanding is that the governor's, in the presentation that was made on Sunday, that those were issued as guidelines with recommendations of reducing, of closing bars and wineries as not essential, but leaving restaurants open, but reducing the capacity and increasing the space between customers there because of the need to be able to provide food for people.
Correct.
But those were issued as guidelines. So it's up to the municipalities to determine whether to issue orders that then make those enforceable in some manner.
Excellent. And a quick follow-up, as you mentioned serving food, are there limitations or restrictions that are currently in place that reduce a restaurant's capacity to have curbside service of food? Or takeout, or like curbside delivery or curbside distribution of food. Is there any type of mechanism that we can allow, suspend, or put a moratorium on any restrictions?
I'm not aware of any restrictions that exist.
So they should be able to do that
for that type of delivery.
Okay, it was a question that it was. So they should be able to operate and deliver food, curbside delivery for food.
Yes.
Okay.
I know in the city of Los Angeles, the mayor has actually encouraged residents of Los Angeles to utilize that as a way to support their local restaurants is please order online, do curbside, or use a delivery service, but don't abandon our local restaurants. Try to keep them operating.
Yeah.
Exactly.
Madam Chair.
Yes.
Real quick. There's a lot of questions I'm sure the supervisors have been asked by constituents in regards to, is my business essential? I mean, should I operate, not operate? And Director Dietrich talked about the ordinance out of Santa Clara, the 6 Bay Area counties. In that Section 10, it lists a whole host of businesses, types of businesses that would be considered essential and non-essential, et cetera. It might be, for those who haven't read it, it's only 7 pages long in total, but it does provide some interesting information. And I think probably just for those questions that we've received here today, and I'm sure there's a lot of questions out there in the public at large, is that maybe next at our board meeting on Tuesday, if we could have a recommendation. I mean, if you just took the whole Section 10 and went through it and picked the ones you like and the ones you don't like, et cetera, it would certainly provide some guidance to our businesses, for example, on what would be considered, what they would be considered essential, non-essential. It does talk about construction, it does talk about farming, it talks about a whole host of things. And I think some guidance, especially when the public is just looking for direction or answers, I think this might be of help. The second part is we've talked about, and I agree, that the county is different cities because we also serve city residents with a variety of services that cities don't provide. So I think at least from my vantage point, I'll leave it up to the chair, but it would seem that if we could give an update at our next board meeting as to what we're doing as regards to providing services to the public, whether it be continue to have, in-person meetings, or if it would be better and we can tell them that they can also do it electronically, so they at least have that idea, because people don't know. They want something and they come down here or whatever, and I think we at least should provide them with some alternatives if they're available. And also, what departments have made some modifications in regards to employees coming to work or working off-site or remotely, et cetera. I just think information is important at this time where people are always looking for, answers. And again, I think this, and it's an extensive list, but I think it would provide at least a starting point for the public to really become more knowledgeable on how they want to proceed, especially as Supervisor Patty talks about in regards to businesses that may want to continue. And I would agree also, they're talking about, DoorDash and all these things. Or, I find in my small city of Ripon, the other night I was out and I ran into 3 Domino delivery vehicles almost simultaneously. They're doing a heck of a business in that city. So my point is I think our businesses and our residents are smart enough and creative enough to overcome this and still live their lives reasonably as in the past without maybe risking their health. And I think we need to, as a county, and to Ms. Lima, in regards to the reimbursement forms, I will tell you from experience, and this may be an exception, we probably need somebody in your staff who becomes the expert on a daily basis to provide direction to the cities. And the reason I say that is they change the rules constantly. And by virtue of that, I think we need to take the lead. Certainly, I appreciate your leadership, but also your staff. And I think that would give the cities a lot of comfort because some don't have the staff to keep up with this stuff on a daily basis. And again, I think the county can take the lead in this particular situation, and especially with our public health and certainly our direction and certainly the information provided. So I just think we have a lot of opportunities here, and I think for the benefit of our residents, both city and county residents, I think we can provide a lot to kind of calm our residents in regards to what's going to happen. So thank you, Mr.
Thank you. Okay, so what we have here for action Sure. Mr. Miles, do you want to clarify for the board exactly what you're looking for?
Be a motion to ratify the proclamation of the local health emergency in San Joaquin County.
Okay. And order that in accordance with the declaration of emergency by the governor, that this declaration will remain in effect until the county health officer terminates?
Yes.
Okay, so two-part. We can do it as one motion?
Yes.
Thank you. I'm looking for a motion.
So moved.
Second.
I would just point of clarification. We had also talked about a local declaration, but that's to come back, or do we want that included that you'll come back? Do you need direction from the board that you'll come back with that local declaration?
No, the local declaration has already been made by Director Cunningham. And the board cannot take action on that today. That will come back on the 24th.
Okay.
To be ratified.
You don't need further direction from us to make that happen.
No, we do not.
Thank you.
Okay, then we have a motion and a second. Everyone cast your votes, please.
My screen is logged out. I'm not able to cast a vote, but I would vote yes, of course.
Okay. Seems to be seized up here. I'm going to assume this is approved on a 5-0.
It is unanimous, yes.
Yes, thank you. Okay, are there any final comments before we adjourn?
Do you have a final?
Supervisor Patty?
Thank you. Been a great meeting. I appreciate all the information coming from staff and directors and all of the many departments, and from the questions coming from the dais up here with the supervisors. I'm also, as some of you may be aware, myself and Supervisor Villaputo on our offices are engaged with the Homeless Winter Planning Group. And I would like to request that we have Adam Cheshire attending our next meeting, which is tomorrow. He hasn't been able to attend some of the recent meetings, but there's some emergency demands and requests and fundraising going on for the low barrier shelters, and it would be helpful if he participated. They are working hard. This work group is working with the low barrier shelters to meet some of these current needs, and some participation would be good.
Okay. Then we are, if there's nothing else, we are adjourned until next Tuesday, March 24th at 9 a.m. Thank you, everybody.